Hey there, I'm Dana Johnson, dental practice management expert, certified Dentrix trainer, and founder of Navoni, revolutionizing the dental industry through innovation and strategic leadership. It wasn't long ago that I lived in your shoes, navigating the daily challenges of managing a dental practice with the hopes and dreams of having a productive schedule, money in the bank, and getting home on time to my sweet daughter. After 25 years working in the dental practice and 17 years as a certified Dentrix trainer, I found my life's work, helping dental teams one-on-one, optimizing their systems and software. If you are looking to create the thriving dental practice you have always dreamed of and empower your high-performing dental team, you are in the right place. Let's get started.
Hey there. Okay, so continuing on this conversation of filling your schedule has been such an explosive conversation over the last 2 months. And please get caught up if this is your first episode. Please go back to start this quarter with episode 104 with the 4 reports for keeping your schedule full. And then they're only 15 to 20 minute episodes, so you should be able to get through them pretty quickly. Last week, we did a deep dive into my favorite report in Dentrix. And if you remember what that report is called, what kind of nickname do I have for that report? If you know what that is, give me a comment in the comments. I'd love to hear if everybody remembers. But we did a deep dive into the treatment manager, and I have a nickname for that report. So if you listen to last week's episode, you'll be able to know what it is. So make a comment in the comments. I want to hear what everybody says. And so we did a deep dive into the treatment manager last week. And one thing I want to expand on a little bit is the fact that treatment planning and treatment management is a full team sport. It involves everyone on the team, not just your admin team following up, but the treatment planning comes from the clinical team. And so today, what I'd like to do is expand on how the clinical team can really help improve the closing rate for your admin team. So if you have a treatment coordinator who is following up with patients with unscheduled treatment, and that person is on the admin team, they might not be a clinical team member. So what I want to do today is give you some insights and some advice on how the clinical team can help the admin team improve that rate of conversion to help them get patients scheduled better and help the admin team with verbal skills and the information that they need in order to answer patient questions. Because here's what usually happens, because I was a treatment coordinator in an office for many, many years and had to schedule and close a lot of treatment. And so here's what usually happens. If a patient has, let's say I have a crown diagnosed today, and, it's not hurting. And, the patient's walks out the door and says, oh, I'll just call you. I'll call you when I'm ready to schedule. Well, the patient walks out the door and doesn't schedule. This happens every single day. And so then if you have a routine schedule way of a system for following up with patients that have unscheduled treatment, like I talked about last week, then what's going to happen is one of your admin team members or your treatment coordinator is going to reach out to that patient that walked out the door without scheduling. And then that patient is going to start asking questions like it's not hurting. Why do I need to have this crown done? And if your treatment coordinator doesn't have the tools right at their fingertips to answer that question for the patient, then the treatment coordinator now has to put the patient on hold, go find the doctor or go find the hygienist or seek out the dental assistant to find out, why does this patient need a crown? He says it's not hurting. And that takes time. Now you have to put the patient on hold, which is frustrating to the patient, time consuming. Or what's going to happen is the treatment coordinator is going to say, well, let me find out and I'll call you back. Well, then what's going to happen is that you have the patient on the phone right now. You should be able to help answer those questions relatively quickly so that you can get that patient scheduled. So what I am here to do today is to give you some tips to give that treatment coordinator the ammunition that they need in order to facilitate the answers relatively quickly. And the way we do that is in the clinical room when it's being diagnosed. And I'm going to recommend 2 different options for you. And because this will make it very easy for you when you are doing it clinically. And then it will be really quick and easy for your treatment coordinator to find that information if you all put it in the same place. So I'm going to give you 2 options, and I'll kind of give you my favorite way, and then you can decide how you're going to do it in your office. So when you treatment plan something, and you treatment plan a crown, it goes on the treatment plan, and it's either down in the progress notes, right? It's either in the progress notes under a treatment plan, or if you're using the treatment plan panel over on the left side of the patient chart, then you'll see all the treatment plan line items, stacking up there under the case. And so if you double click on that procedure code, there's a procedure note box there, okay? I love, love, love this box for the diagnosis. And you can also template this diagnosis box. So you'll notice that there's this little edit note, I think, button. You can click on that. You could put in some templated diagnosis, maybe just some sentences or some words, 3 or 4 words as to what is wrong with this tooth. So it could be something like fractured tooth, open margin, recurrent decay, existing crown, 10 plus years old, ill-fitting, whatever it might be that is causing this tooth to need a crown. Because then if you put that in that procedure note, then what's going to happen is when your treatment coordinator is working the treatment manager report, she has to do some research before she picks up the phone. So if she goes and opens up the patient chart and she sees the procedure note on that procedure code, now she's got the ammunition she needs to answer the patient's call, answer the patient's questions. So when the patient says, the tooth isn't hurting, why do I need to have that crown? Well, now she can say something like, well, it looks like that tooth has an existing crown on it and there is some recurring decay. So it's possible that there could be decay under that crown. So you may not be having any pain right now because it also looks like that tooth has a root canal. So there is a possibility that you're not having any pain with that tooth. Now, it might be something different. It might be something like there's a fracture. So the patient says something like it doesn't hurt. Well, then your treatment coordinator could say something like, well, it looks like that tooth does have a fracture on it. Now, you might not be having pain right now, but if you bite down on something, that fracture could give way and then half the tooth could be gone. Now, you don't want to end up in an emergency situation at some cocktail party sometime with a half-gone tooth, and now you're in pain. So we are trying to prevent you from having that tooth fracture completely by putting a preventative crown over the top of that fracture. So having those kinds of diagnosis tools right there at your fingertips can then prepare you for those questions. So that's my first option, is to use the procedure note. All right, when we come back, I'll give you my second option. Did you know that you could increase your team's productivity by up to 200% if you had a formal team training program in place? And businesses that do have a formal team training program in place also enjoy up to a 24% increase in profit margin. If you want to learn how and book a call with me, click on the show notes and book a free discovery call with me, and we will talk all about it. All right, my friends, welcome back. Now, the other way that you could do it is to build in the diagnosis or the like recommended verbal skills or something in like at the end of the clinical note. So at the end of your clinical note, you should have something that says like next visit, hygiene, next visit, doctor. And then the next visit doctor line might say number 30, crown, 9 units, Dr. B. And then you could put then a description of why does that tooth need a crown. So you could put maybe the diagnosis underneath that or in the middle of that or somewhere, because I train my offices to have in the clinical note that really helps the admin team is what happened today and what's next. So that the admin team, when they're checking the patient out for the day, they can see, okay, what did we do today? Okay, we did an exam, prophy, fluoride, bite wings. And what's next? Oh, we need a crown, number 30, has a fractured buccal margin, or has an existing crown, recurrent decay. So if you have that, that is such great information for your schedulers, because if the patient walks out the door without scheduling, and then your team is following up using the treatment manager report that we were talking about last week, and the patient starts asking questions, then you can either use the procedure note, which I just talked about, or your clinical note. It should be in one of those two places. I don't really care which place it is. I like both. The clinical note is always going to go with the clinical note is your legal documentation, but the procedure note is like an extra little spot that's super easy to get to, and it's very convenient for your team to see it because it's a quick visual. Sometimes you have to scroll through and read through clinical notes, but I want it in one of those places. So make a decision with your team, the consistent place where your treatment coordinator is going to find why does this patient need this treatment? Because then when the patient starts asking me questions, I have all the tools I need to answer their questions, sell more dentistry, and fill my doctor's schedule. All right, my friends, I hope this was helpful. And if you liked this episode, if you found it informative, please rate it, review it, share it with your colleagues. And I hope you have a great rest of your day. And I look forward to watching your journey of becoming a high-performing dental team.